So we've said a word of friends, so we'll just begin walking through the slides. And so this week, I'd love us to look at digestive disorders. Digestive system, there's a mistype there. Either way. This week I want us to focus on digestive disorders before the month ends. Normally, what we do during our trainings, we normally study anatomy and physiology systematically. According to the systems that we have in our body, we have 11 systems in our body. The digestive system is part of the 11 systems. And so what we normally do, we normally study a system. That's the anatomy. It means the body organs and how they are located in our body. We normally study anatomy and physiology. Physiology is the functions of these different body organs. So we normally study the anatomy and physiology of a particular system. And immediately after that, we normally look into the disorders or the diseases that are related to that particular system. So why do we normally do that? It's normally easy to understand diseases and disorders with a background knowledge of how best your body functions. And so today, just to begin our trainings, I'd love us not to take that particular path in the first week. So we'll just begin studying the disorders. And today specifically, we'll be studying peptic ulcers. Peptic ulcers, probably it's a phrase that is new to some of us, or probably it's not new to all of us or most of us. And so peptic ulcers, simply put, an ulcer is a wound or an open sore. And peptic simply it means a tube. And so peptic ulcers is an open sore that develops on the inside lining of the stomach and the upper portion of the small intestines and also the esophagus. The stomach, the esophagus, and the duodenum, these are organs in our body, in the gastrointestinal system. Gastrointestinal, what I simply mean by that is in the digestive system. The digestive system can also be referred to as the gastrointestinal system, that is the GIT, or the gut. But mostly, the stomach is normally referred to as the gut, most people. And so when I use the GIT or the gastrointestinal system, just know that I'm talking about the digestive system. And so peptic ulcers, it's a disease. Most of us normally call it ulcers, that plainly. And so ulcers is a breakdown in the continuity of mucous membrane. And in our intestinal lining, in the lining of the digestive tube, we normally have layers. And the uppermost layer it's normally a protective layer that is made up of mucus. And that uppermost layer is called the mucosa. And then we have the layer that follows after the mucosa. Normally it's called submucosa. And then we have the and then I was admitting Jeremiah. Welcome, Jeremiah. And so we have layers in our gut lining. And the uppermost layer, as I have said, it's the protective layer, and it is always plated with mucus. What the mucus normally does, mostly in the stomach, it prevents the stomach from digesting itself. In the stomach, we'll study all these again because it's better understood with a knowledge of the normal functioning of the stomach, or with a knowledge of physiology. So this in the stomach, there are glands, or let me call them cells. They are cells that produce different types of secretions that are responsible for digesting food in the stomach. It is same to the duodenum. It is also the same thing in the mouth. In the stomach, I believe that most of us do know there is an hormone called pepsin. Pepsin is an hormone. What I mean by an hormone is more of a functional. It's an hormone as a look at an hormone as Okay, let me power my laptop. Okay, so I was saying that an hormone normally you can look at it as something that helps in different functions. An example, the hormones in the blood that helps to normalize blood sugars and all that. There's an hormone in the stomach that helps in digesting proteins. That's the pepsin and the rest. So in the protein, there are a lot of juices. There are lots of hormones that are secreted for the digestion of protein, for the digestion of carbohydrates. We learn that carbohydrates are as well digested in the stomach. There are some carbohydrates, not all. Mostly carbohydrates are digested in the duodenum, a larger percentage of carbohydrates. There are fats that are digested in the stomach, though a larger percentage is digested in the duodenum. And so the main secretion, the main juice that is being that normally is secreted in the stomach is HCl. HCl is hydrochloric acid. It's an acid, and the stomach normally has a low pH. The pH of the stomach is normally acidic. I believe most of us understand what a pH is. The pH in the stomach is normally very, very low. It normally ranges from 2 to 1. And so proteins should be digested in such a condition. And our stomach walls, being made up of meat or flesh, it is a protein. And so without the protective lining, it can easily be digested by HCl. And so what has the Savior placed to prevent that mechanism? There is a balance of different functions that we'll see when looking at physiology that helps in maintaining the gut health. That helps in maintaining the gut health. And one of these is mucus. There's normally a mucus lining in the gut that helps protect the stomach walls from being digested by HCl. And so when that goes bad, when that particular mechanism goes wrong, a wound is created in your stomach. When the balance is interfered with, a wound is created in your stomach. And so we'll see some of the things that leads to that imbalance. We'll see some of the things that erodes the mucus lining that is meant to protect the stomach and the gastrointestinal walls. We'll see some of the causes and all that. And so that's just a brief history to the function of to the functioning of the stomach. And so we have different types of peptic ulcers. We have different types of peptic ulcers. The most common ones are 3. That is the esophageal ulcers. Esophageal ulcer is found in the lower part of the esophagus. Esophagus is a tube through which food gets into the stomach. And so through the esophagus, in the lower part of the esophagus, there can be a wound, and the wound is called ulcers. And so how is this normally caused? How is this normally caused? We'll see. There's a disease, there's a condition called GERD, or the gastroesophageal reflux disease. This is where the content in the stomach normally is called chyme. So in GERD, or gastroesophageal reflux disease, what happens? The stomach content called chyme, it normally rises into the esophagus. There is a wall, there is a sphincter. A sphincter, view it as a door. In each and every segment or border of different organs of the gastrointestinal system. So before getting into the stomach, there is a door that closes the pathway between the esophagus and the stomach. And so that door that closes the pathway between esophagus and the stomach is called esophageal sphincter. And so when the esophageal sphincter is weak, what happens is when the stomach is churning food, the chyme in the stomach can regurgitate into, or rather it can climb back into the esophagus, because the door is weak and it's not doing its function of keeping or storing food in the stomach. And so when food gets into the esophagus, the acid can easily corrode the mucus lining in the esophagus. The mucus lining in the esophagus is not that strong as the one that is in the stomach. So the major cause of esophageal ulcers is GERD. GERD can be chronic. By chronic, what I simply mean, it can last in a very short time. An example of GERD is heartburn, indigestion, and all that. I believe most of us know what heartburn is. So smoking, alcohol can as well cause esophageal ulcers, though we'll look into that more deeply. We have duodenal ulcers. Duodenal ulcers is a type of sore or wound, or an opening that is in the upper part of the duodenum. I believe you can see that in the picture. The duodenum is the pathway between the other parts of the small intestine and the stomach. So what happens? What happens? Duodenum. So duodenum, that is duodenal ulcers. And then we have gastric ulcers. Gastric simply means stomach. Gastric means stomach. So gastric ulcers, simply put, is stomach ulcers. This is an open wound in the stomach wall. It can be anywhere in the stomach walls. Up to that particular point, is there any concern? Up to that particular point, is there any concern? Okay, no hand is raised. So I'll continue to the etiology. Etiology here, it simply means the causes of the different types of ulcers. And so the main cause of ulcers is, somebody unmuted, Jeremiah.
Oh,
thank you. So the main cause of ulcers is hyperacidity. Hyper simply mean elevated. So elevated levels of acid can easily cause ulcers. And so there are things that would hinder, probably negatively or positively, there are things that can affect production. There are things that can affect the normal production of acid in our stomachs. And so an example is an infection called H. pylori. H. pylori is a bacteria, and normally it causes stomach infection or inflammation. And so this particular bacteria can interfere with the cells. An example of a cell that produces HCl, that is hydrochloric acid in the stomach, is called parental cell. And so H. pylori bacteria can interfere with the normal functioning of this particular cell, parental cell, to an extent that the parental cell will produce a lot of gastric secretion. Gastric, I mean stomach secretion, that will eventually lead to the corrosion of the protective layer or the protective lining that we talked about, that is the mucus. And so Helicobacter pylori or H. pylori, so it causes inflammation, it causes stomach infection. Probably most of us have ever heard of a medical term called gastritis. Gastritis simply it's stomach inflammation. And one of the complications of stomach inflammation is peptic ulcers. So H. pylori is normally a major cause of gastritis or gastric. I said it means stomach. And in medical term, if you see itis, it means inflammation. So if someone tells you pancreatitis, it means the inflammation of the pancreas. If someone says mastitis, it means the inflammation of the mast cells, wherever they are. It could be probably in the ear, in the stomach. If someone tells you gastritis, it simply means stomach inflammation. And so Helicobacter bacteria can easily cause hyperacidity in the stomach. And something interesting, there is what is known as normal flora or the gut flora in our system. The gut flora simply the gut flora is the normal balance between the good and bad bacteria in our gut, in the GIT system. And so anything that interferes negatively with the normal flora, let's say anything that empowers more the bad bacteria, would negatively interfere with the normal flora. Because one of the protective mechanisms that our Savior has placed to maintain the protective lining, that is the mucous membrane, is the gut flora, the balance of good and bad bacteria. And these bacteria, they need some foods from our diet to live. They need foods from our diet to actually live and survive. An example, most bacteria feed on fiber. There are certain kinds of fiber that they feed on, the soluble fibers. And so when we eat a diet that is insufficient of fiber, in a sense, we are starving our good bacteria. We are starving the bad bacteria, and our gut flora can easily come into imbalance. And once that happens, the H. pylori will take dominance, and complications will begin. And once the mucus lining is corroded, what happens is the HCl will start digesting the stomach wall. Since the stomach wall is a protein and HCl, what it does, it digests protein. So some other thing is chronic non-steroidal anti-inflammatory drugs. So a chronic usage of NSAIDs, it normally interferes with this particular flora, the gut flora, the normal flora in our gut, because most of them, the antibiotics, they normally kill the bad, the good bacteria. They normally kill both the bad and the good bacteria. And so they might kill more of the good bacteria, letting the bad bacteria to take dominance. One of the bad bacteria here is H. pylori, and that could easily lead to hyperacidity, corrosion, hyperacidity, and then once acidity kicks in, the corrosion of the stomach walls. We have cigarette smoking, and interestingly, cigarette smoking, it normally impairs mucosal blood flow. For the mucus to survive, it needs a good flow of blood. And so cigarette smoking interferes with the blood flow. And so in an essence, it will interfere with the mucus lining, since now the blood is not flowing well there. And it also interferes with healing, any kind of healing. If you have stomach ulcers already and probably you are still smoking, the ulcers will not quickly heal. It won't easily heal. And so cigarette smoking is also a problem or a risk factor or a cause of ulcers. And then we have what we know, what is known as alcoholism, excessive drinking. Anything that is bad, there is normally no moderation. You shouldn't do them in moderation. That's what temperance basically calls for. And so alcoholism, alcohol in itself corrodes the mucus lining. In itself, it corrodes the mucus lining, and it empowers secretion of pepsin. It stimulates the secretion of gastric secretion, or rather, an example of gastric secretion is HCl. So alcohol would increase hyperacidity. At the same time, it will corrode and erode the mucus lining. And then we have high dosage of a class of medications called steroids or corticosteroids. These are synthetic hormones. These are therapies that are normally given to probably people who have diseases like Hashimoto or hyperthyroidism or hypothyroidism. Those who probably are just stressed and they need some kind of hormonal therapy. So corticosteroids, when taken in high dosages, they can cause ulcers. Examples are those given there: cortisone, examples of NSAIDs are also given there. We have aspirin and brufen. I believe these are common medications. And then we have some lifestyle habits that we'll talk about in the coming slides. So those are some of the causes of ulcers. And the third cause is the drugs. These drugs that are known commonly, NSAIDs commonly, they're used for pain and inflammations. They're normally, most of them are normally OTC, over the counter drugs. So I want us, we've talked about these two slides that of which one of them I'm on. We've talked about the pathophysiology of ulcers. Pathophysiology simply mean patho means disease, physiology simply mean function. So pathophysiology simply means how the disease comes about, or how the disease, how the disease comes. So we've seen the causes. It could be due to drugs, alcohol. We've not talked about the lifestyle like coffee, tea, which have caffeine, which are irritants, and caffeine actually increases secretion. When there is caffeine in the stomach, secretion of HCl will be increased, hence leading to hyperacidity. And so chronic usage and frequent usage of such will eventually lead to ulcers, stomach ulcers, duodenal ulcers, or esophageal ulcers. And when you have ulcers already, taking such will worsen the ulcers. And so what happens is excessive secretion of HCl and decrease mucus secretion. The mucus, we really need it. The mast cells are responsible for secreting mucus. And so once you take foods that rob these particular cells from their necessary food like oxygen, you'll hinder their normal functioning. An example of such foods are highly processed foods, deep fried foods, like chips. We have junks. We have sugar, the simple sugars, the industrial sugars. Actually, someone who has H. pylori should not take at all anything that is highly refined, like white rice. So these things are very dangerous. So breakdown of mucous membrane of the stomach, that's what happens next when there is excessive HCl, that is acid in your stomach, and also when the mucus secretion by the mast cell is decreased. So what happens? The breakdown of mucous membrane of the stomach, because as long as there is acid in the stomach, the mucous membrane will be corroded. And so what normally makes it safe is the continuous replace of that protective layer by the mast cells. So we see acid now enters into the gastric mucosa, that is the stomach lining where we now have the meat and the fleshy part. And then gastric ulcers is caused. The acid now starts eating and causing sores and wounds, or probably the pores. And that becomes the onset of all our troubles, of all our pains. And so fasting could also cause ulcers. Long time fasting can also cause ulcers, because when you do that for long, the stimulation of vagus nerve is a parasympathetic nerve. It's more of a network between the brain and the stomach, where chemical messages are passed from the stomach to the brain. So when the vagus nerve is stimulated, then it increases gastric secretion. And when gastric secretion is increased, now that there is no food in your stomach, what this HCl will be doing is eating or corroding the mucus lining. So HCl secretion level increases. That leads to duodenal ulcers, because it will get into the duodenum. So mostly fasting leads to duodenal ulcers. So is there any question up to that point, or probably a concern?
It is okay. It's okay, I think.
Okay, thank you. So we continue to
I have a question.
Yes, who has a question? Is it Diana?
Yes, I have a question.
Yes, yes,
Nini,
kindly ask. Ask
why
me,
women
please.
why
Yes, ma'am.
why women have hydrodermal ulcer than men?
Okay, we'll answer that along the presentation. Thank you. So signs and symptoms. Probably most of us don't understand what epigastric pain is. There's normally a way clinicians approach abdominal pains, cause depending on the location, I believe my slides are still visible. So depending on the location of the pain in your abdomen, depending on the location in the pain in the abdomen, we can easily tell where the problem is or what organ is affected. So depending on the nature of the pain, depending on the location of the pain, we can easily tell the disorder or the problem someone is manifesting. An example, epigastric pain is normally it's normally common for it's normally a common symptom for ulcers, peptic ulcers. Epigastric, epi simply means on top. Epi simply means on top or center. Gastric simply means the stomach. So epigastric is normally, I really don't know why I didn't include that the picture, but we'll see this as we move on. We'll learn and know how we can do abdominal examinations and all that. So there is this part there is this part of your stomach that is just on top, the part on top of the umbilical cord, the part on top of the umbilical cord, just below the breast, the breast bone, the breastbone, the part we normally call the chest, above the umbilical cord, below the breastbone. Okay, when you have heartburn, there's that part you normally feel some burning sensation. Yeah, so there, that particular section of the stomach is called the epigastric region. And so when someone has abdominal pain, most patients normally say that they are having stomach pains. So as a clinician, the first question that probably will be asked, okay, I don't know how best to put that. But the first question probably a clinician would ask you if you talk about an abdominal pain, they'll ask you, where are you feeling the pain? Can you point? And then from that, they'll definitely just know. So for the most common sign and symptom clinically for peptic ulcers is epigastric pain. Normally, it manifests in a burning or an aching way, and at times it can be easily confused with heart attack. At times, it can always be confused with that attack. And so this particular pain, normally it comes 45 to 3 hours after your meals, during the day after your meals. And it normally worsens at night, and it can wake you up at night. It can wake you up at night during the probably from 1 to 2 p.m. I've had experiences with ulcers before, And at that particular time, I was actually busy to an extent that I could not take my meals regularly. I used to take one meal in a day, and it used to be at around 4 p.m. East African time, 4 p.m. And so that happened for about 1 week, and I ended up having ulcers. And in 2, 3 occasions, I could not easily sleep at night. I used to wake up at night. But with time, without any medications, just by dietary and lifestyle modifications, lifestyle modifications, I just went back to my normal eating habits, and it reversed by itself without applying any medications. But there are those who will definitely need medications, mostly for chronic cases. And so that is the major sign and symptom for ulcers. At times, it can come with nausea, vomiting, bloating, belching because there's a lot of gas in the stomach, appetite. At times, you can even vomit blood. That is when it is stomach ulcers. When it is duodenal ulcers, at times you might have some bloody or dark stool. Stool is the fecal matter, and so those are some of the signs and symptoms that can help us know if someone or a patient of ours is suffering from ulcers. And so once you substantiate that the patient is suffering from ulcers, you can easily now talk to them about the causes that we just mentioned, and educate them right on how to stop, or rather on how to wisely reverse their condition. I believe we caught the causes. So I'll pause to ask a question before we get into the last section of our slides. We have 5 more slides to go. We've covered 7. So on treatment and management, from what you've learned so far, Joel, what are some of the recommendations you'd probably give to someone with gastric ulcers from what you've learned today so far? Anyone willing to respond, and anyone would want to respond, you can kindly just raise your hand, and then I'll see and choose you. What are some of the advice now? Yes, Kerubo.
Uh, oh, yes, sorry, good evening. This is Joel.
Yes, Joel, go ahead.
Some of the recommendations I will give is maybe to check on the dietary lifestyle of a patient, and this will include also to know medications that a patient could be on, and if a patient could be advised maybe to reduce or rather to stop them or given alternative medications, because we've seen some of them could be steroids, anti-inflammatory drugs, non-steroidals. So I will advise on maybe a reconsideration of the medication, and maybe preferably to stop them if possible. Thank you.
Thank you, Joel. Asnet, you can go next before we continue. There's a gadget that there's a function that looks like a microphone. You can click on it and probably you'll be able to unmute and speak. Okay, so we'll continue. She's willing to answer, but probably there is challenge. So we'll continue to the treatment and management of peptic ulcers. And one of them is to avoid working out or avoiding these particular causes that we mentioned. And so technically, there are two ways of approaching chronic or any acute or chronic peptic ulcers disease, PUD. And that's one of these is using antibiotics. And you'll use antibiotic if you are infected with Helicobacter bacteria. If you're not infected with Helicobacter bacteria, the second thing that probably could be used is using something that could help neutralize gastric acid, because all of these factors, all of these causes, they lead to hyperacidity. And so in hospitals, there are a class of drugs called proton pump inhibitors. Proton pump inhibitors, they inhibit or slows down secretion of gastric juices. And we have another group of class or another class of medication called acid blockers. Acid blockers. They also help to neutralize the acid that already is being used. An example of acid blockers, I believe most of us know citramide. So in an hospital setup, not really in an hospital setup, but normally that's what would be used. So our first assignment would be, I want us to go and learn. I want us to know the mechanism of actions. Go and just write some of the mechanism of actions of this class of drugs called proton pump inhibitors. They help to neutralize gastric acid. Yes, there are slides. And then we have acid blockers. That is H2 blockers. Go and do also research on their mechanism of actions, because the treatments here that I have, they are in two parts. That is dietary recommendations and herbal therapies. And all these will work to, number one, eliminating the H. pylori, the antibiotics in the formulas that I have in my slides. They'll eliminate the H. pylori. There are antibiotics. They are not synthetic. They are natural alternatives to antibiotics. And in the formula, there are herbs that have included that would help neutralize gastric acid and they would help the mast cell to produce more of the mucus lining, or to secrete more the mucus, for it to protect the stomach. So in the treatment, let's now get to the treatment. In the treatment and management, there are two ways that we'll approach that. Number one, through dietary changes. We are told that a curse causeless shall not come. A curse causeless shall not come. So in Proverbs, Solomon tells us that a curse causeless shall not come. And so to do away with the curse, you have to first do away with the causes. And this is where now dietary recommendations would come in handy. So one of the things that you'd love to that you'd want to avoid when you have peptic ulcers is caffeinated or decaffeinated things. Anything that is caffeinated or decaffeinated. Decaffeinated coffee, caffeinated coffee, avoid all of that. I didn't include that in my slides. So we have avoid alcohol and smoking, we've explained. Avoid snacking. Snacking here means taking food between meals. You should either take 2 or 3 meals in a day, 2 or 3 meals. And in between, you shouldn't take anything at all. And so the spacing also matters. I've said consistency in meals. The spacing also matters. And according to the councils in the spirit of prophecy, 5 to 6 hours. Okay. So what do I mean? When you have your first food at 8 p.m., at 8 a.m., it means that the second time that probably you can take something called food is 1 p.m. after 5 hours, or 2 p.m. That's after 6 hours. And so in between, before 1 p.m., in between 8 to 1 p.m., it's only water that you should take, because you can easily program your stomach to producing acids. The stomach can easily be programmed to produce acids at different times, because there's a vagus nerve connecting the stomach and the brain. So when you are used to taking your meals at a specific time, let's say 8 a.m., when it gets to 8 a.m., your stomach, you'll start feeling hungry. That is your brain notifying the stomach cells, and so gastric juices starts is produced. And so what happens if you eat all the time consistently, probably 10 times in a day? Okay, probably that's illogical, but there are those who normally eat more than 5 times in a day. So what happens? Gastric juices will always be secreted in your stomach almost all the time, every time throughout the day. And so the corrosion of those walls will be very rapid. Not really very rapid, but very, very frequent. So avoid snacking. Take 2 or 3 meals in a day. Those are some of the advices that you'll be giving your patients. Do not drink with your meals. Do not drink with your meals, because the food will take a very long time in your stomach so that the water can be taken out of the stomach. And as the food stays in the stomach, it ferments, and fermented foods are corrosive to the mucus lining. So do not also take fermented foods or highly spiced foods. That is irritating spices. irritating spices and condiments. Do not take acidic foods also. So what drinking with your meals will make the food acidic because it will take some time in your stomach. It will also make the food ferment. Anything that has fermented is acidic because it has some alcohol content in it. Do not take late night meals. What I mean is taking meals and then going immediately to bed. You should take at least 3 to 4 hours before going to bed after eating. And if you eat the third meal, it should be the lightest meal. The Spirit of Prophecy gives a counsel in regards to that. And she says that some twice baked bread and some cereal milk is enough as your third meal. It should be something light. It should be something light. Probably fruits. Yeah, it should be something light. So if someone has ulcers and they take food and then immediately go to sleep, or they go to sleep before digestion is completed, the 3 hours, if it's a light meal, digestion shall have been completed. Like food shall have been taken out of your stomach. So do not take late night meals. At least try as much as possible to have your last meal at 6 p.m. because according to the things that we learn, according to the lifestyle habits that we learn, at 9:30 you should start readying yourself to go to bed and sleep because 10 p.m. should not find you awake. It's a health benefit. It has some health benefits that comes with it. So we have digestive work, and here what I simply mean is you shouldn't eat and then immediately go to sleep, or just stay there on your chair and doze off, or just sit and do your work, or probably read, or whatever, whatever can be done after eating. After eating, you should take a digestive walk. You should take a walk for about 10 to 15 minutes to aid in digestion, and after that, someone can now sit and read and do their things, but not sleep. Consistency in meals I've talked about. If it's 8 a.m. breakfast, it should always be 8 a.m. Only a leniency of 1 hour is given in the Spirit of Prophecy. We'll see all those quotations. Do not mix fruits and vegetables. This will increase acidity in your stomach. There are types of fruits that should not be mixed with other fruits. An example is watermelon. Watermelon should not be mixed with any fruit. So the thing is, acidic fruits and sweet fruits should not be mixed together. Acidic fruits and sweet fruits should not be mixed together. An example is mixing mango. Mango is a sweet fruit, and mango and lemons, or the citrus, the fruits in the citrus family. Acidic and sweet fruits should not be mixed. Acidic and subacidic fruits can be mixed, as sweet and subacidic fruits can be mixed. An example of a subacidic fruit is pineapple. Pineapple can easily be mixed. You can easily, it's okay to take pineapple and your mangoes. But the best thing is taking fruits individually. If you don't know that, probably you might forget those rules. Just take one fruit at a time, or at a serving in a serving. So chew your food well, because if you don't chew it well, it will take a long time in the stomach being digested, and that will lead to more and more HCl being produced. So chew your food well. Take foods high in fiber. Take foods that are high in fiber. They'll help in your gut flora. As we said, avoid those that are highly refined. Avoid fatty foods. Avoid junks. Avoid fried foods. They'll negatively impact your gut flora, and you need your gut flora for the mucus to be in check, or in to be in balance. Increase intake of vitamin A rich foods, which is known to increase the production of mucus in the gut. Vitamin A foods, an example is your vegetables, your yellow tubers. You'll find vitamin A in tubers. You'll find vitamin A in your fruits. You'll find vitamin A in anything that you normally cook that is yellow. The things that have beta carotene. An example is carrots, the squash, alongside others. For high fiber foods, here we are talking about whole grains. So that is the first step in treating peptic ulcers. It is fast, and the main reason why it is fast, because it is the major way of treating such conditions. So if someone has chronic, probably ulcers, you can now go to herbal therapies. And so here I've listed some herbs that can be easily found. There are lots of herbs that can be used to cure ulcers. So this is just a few, at least. Actually, you can cure ulcers by using cayenne alone. Taking high dosages of cayenne, if your patient can take that, can cure ulcers in 1 week. Cayenne will heal the wound. It will kill the bacteria. It will increase the secretion of the mucus that is responsible for protection. So we have golden seal. It would also do the same thing. We have aloe vera juice. It would also do the same thing. We have honey. Honey is an antibiotic.